things have changed a lot since I've been a pediatrician. One of the big things that have changed is the electronic medical record, which has taken a lot of time away from the time we could spend with patients because we're charting. By the same token, what you have in the electronic medical record is easy access to information to help you take care of the patient. So for example, on our electronic medical record system at Seattle Children's Hospital, we have a tab we click which takes us right into the hospital library, and in that hospital library is an e-portal which takes us directly to Pediatrics in Review. Wow, I have learned so much from reading Pediatrics in Review from a very young age as an intern in general pediatrics in the middle 80s to now. And one of the things that's changed significantly is obviously the format. So initially there was that blue tint to the front with pictures of kids and providers, and the pictures of the providers who wrote the articles were in there. But one of the things that was really fascinating about this journal, even from the very start, was that there was ways to test your knowledge, to make sure you actually read the article and learned something from it in a way that wasn't very easy. So the questions were always challenging. And then you got credit for doing it, which was just brilliant. And then as the years progressed, the format changed. Actually became a little bit easier to read and download. And also the questions got harder. So it was even harder to answer these questions, but it was easier to get credit for them. So we could submit them not by putting a stamp on an envelope and mailing them, and we could actually do the questions online and get credit, which we need for our continuing medical education credits. Plus you just felt pretty smart if you got these questions right. The other thing that was really important is the index of suspicion part. The index of suspicion part, you had to take a second if you wanted to dive into that, because that required you to really think about it and wonder what it is that this child or young adolescent or teenager or adult, young adult had. You had to kind of unpack what's going on with them and go through the entire history and then think and use your mind to make a differential diagnosis, review the tests that were done, and then actually see if you came up with the same answer that the experts did when they wrote the piece. So it was just, what's wonderful about Pediatrics in Review is that it allows you to really test your knowledge and learn something at the same time in a format that was easy to read, easy to tuck in your bag if you were getting on a plane, or easy to open if you're at your hospital library.